Type 2 diabetes is a chronic disease that affects the way the body processes glucose, the main fuel for cells. If left unchecked, it can lead to serious complications. Many people may have the condition for years without realizing it, as symptoms can be subtle and appear gradually. Recognizing the signs is essential for early diagnosis and disease control. Let's explore the main symptoms that you should watch out for. Main symptoms: excessive thirst, polydipsia. Excessive thirst, also called polydipsia, is one of the most common symptoms of type 2 diabetes. This phenomenon occurs because the level of glucose in the blood becomes so high that the kidneys cannot filter it properly. To deal with this excess, the body begins to eliminate glucose through urine, a process that requires large amounts of water. Urine becomes more abundant and frequent, leading to a significant loss of fluid. This cycle of urinating more and losing more fluids causes the body to enter a state of dehydration, which in turn generates a constant thirst. The person drinks more water in an attempt to rehydrate, but the elimination cycle continues. Even with high water consumption, thirst persists, as the body cannot compensate for fluid loss. If type 2 diabetes is not controlled properly, it can lead to serious complications and even death. This is because the high level of glucose in the blood, when left untreated, can cause permanent damage to different body systems. The following explains what can happen if certain measures are not taken. Not controlling blood sugar levels. When a person with type 2 diabetes does not control blood glucose levels, persistent hyperglycemia, high sugar, can damage blood vessels, nerves, and vital organs. This significantly increases the risk of complications that can be life-threatening. It can lead to serious complications including cardiovascular diseases. High glucose levels increase the risk of heart attack, heart failure, and hardening of the arteries, atherosclerosis, which can be fatal. Kidney failure. Kidney damage can result in dialysis or transplantation, and without treatment, lead to death. Blindness and amputations. Diabetes can cause vision loss, retinopathy, and foot sores, leading to amputations. Diabetic coma. Glucose levels that are too high or too low can lead to a coma that, without immediate treatment, can be fatal. Stroke. The risk of stroke increases, which can cause death or severe disability. In addition to physical dehydration, high glucose concentration can also affect the function of certain neurotransmitters in the brain, amplifying the feeling of thirst. This generates a continuous and sometimes uncontrollable need to drink water. Increased urinary frequency, polyuria. Polyuria, or increased urinary frequency, is directly linked to the body's effort to eliminate excess glucose. When blood glucose levels exceed a certain threshold, the kidneys begin to expel excess glucose through the urine, a process called glucosuria. This mechanism involves the withdrawal of large volumes of water to dilute the excreted sugar, significantly increasing the volume of urine. This process mainly impacts the nightlife of people with type 2 diabetes, as they have to wake up several times during the night to urinate. Nocturia. Nocturia can impair sleep quality, generating more fatigue during the day and affecting the daily routine. This cycle of urinating more often can also cause a feeling of constant tiredness, as sleep deprivation and dehydration go hand in hand. Continuous fluid loss without adequate replacement can also lead to kidney problems in the long term. When left unchecked, this overload on the kidneys can lead to kidney failure, one of the most serious complications of poorly managed diabetes. Constant hunger, polyphagia. Excessive hunger or polyphagia in type 2 diabetes is deeply rooted in the imbalance of glucose metabolism. The body uses glucose as the main source of energy for cells. However, in type 2 diabetes, cells become resistant to insulin, the hormone responsible for allowing glucose to enter cells. As a result, even with elevated blood glucose levels, cells feel that they are hungry. This false hunger signal causes the brain to send messages to consume more food, which leads to an increase in appetite. Unfortunately, the more a person eats, the more glucose levels rise, aggravating the problem. Food intake does not relieve the feeling of hunger, as glucose remains trapped in the bloodstream, not being used correctly by cells. The problem is even more complicated because many foods that people eat to satisfy this exacerbated hunger are high in carbohydrates and sugars, which further worsens glucose control. This vicious cycle can lead to weight gain, Another factor that contributes to the worsening of type 2 diabetes and its complications. Extreme fatigue. Fatigue is one of the most debilitating symptoms of type 2 diabetes. It occurs because although the body has a significant amount of glucose circulating, this glucose cannot be efficiently utilized by cells due to insulin resistance. Without this source of energy, the cells enter a state of hunger, which results in constant fatigue and a feeling of exhaustion. Another factor that aggravates fatigue is the combination of dehydration and lack of sleep caused by polyuria. With the body trying to rehydrate and frequent sleep disruption, the person with type 2 diabetes may feel increasingly exhausted. In addition, unprocessed glucose in the blood causes a buildup of toxic products called ketone bodies, which also contribute to feelings of weakness and tiredness. Over time, fatigue can turn into a barrier to daily activities and exercise, which is an additional problem, since lack of physical exercise is a contributing factor in worsening diabetes. Blurred vision. Blurred vision is a common and worrisome symptom of type 2 diabetes. When blood glucose levels rise, they change the shape of the lens of the eyes. This affects the way the eyes focus light, resulting in blurred or blurry vision. Initially, blurred vision may be temporary and resolve as glucose levels are controlled. However, if diabetes is not treated, changes in vision can become more permanent. The high level of glucose affects the small blood vessels that supply the retina, causing a weakening of these vessels. This process can lead to diabetic retinopathy, a condition that can result in total vision loss if left untreated. Strict blood glucose control is key to preventing permanent vision damage. In addition, it is recommended that people with diabetes undergo regular eye examinations to monitor any changes in the retina or blood vessels. Slow healing wounds. Type 2 diabetes also affects the body's ability to heal wounds. Excess glucose in the blood interferes with the natural healing process, affecting blood circulation and immune system function. Areas with less circulation, such as feet and legs, are especially vulnerable. Small cuts and scratches can turn into serious wounds, often leading to infections. The risk of infections is increased by the constant presence of glucose in the blood, which provides an ideal environment for the growth of bacteria and other pathogens. In severe cases, improper healing can result in complications such as gangrene and amputations. Risk factors. Type 2 diabetes is strongly influenced by lifestyle factors, although genetic components also play a significant role. Below are the main risk factors that can increase your chances of developing the condition. Overweight and obesity. Overweight is one of the most significant risk factors for the development of type 2 diabetes. The accumulation of fat, especially in the abdominal area, is associated with insulin resistance, which makes it difficult for the body cells to efficiently use glucose for energy. When the body cannot utilize glucose properly, blood sugar levels rise, resulting in the chronic condition of diabetes. Obesity also contributes to chronic inflammation, which can trigger a number of adverse responses in the body, worsening the risk of diabetes. In addition, obese individuals often have higher levels of triglycerides and LDL cholesterol, the bad cholesterol, which can further impair metabolic health. Sedentary lifestyle. Lack of regular physical activity is another critical factor that can increase the risk of type 2 diabetes. Physical exercise helps control body weight, improves insulin sensitivity, and lowers blood glucose levels. When people remain sedentary, their muscles use less glucose, which can contribute to increased blood sugar and insulin resistance. In addition, physical activity promotes weight control, strengthens the cardiovascular system, and reduces stress levels, all important factors for preventing diabetes. Family history of diabetes. If you have a family history of type 2 diabetes, your chances of developing the disease increase considerably. Genetic factors influence predisposition to diabetes, since certain families can inherit genes that make their members more susceptible to insulin resistance or beta cell dysfunction, responsible for insulin production in the pancreas. In addition to genetic inheritance, eating and behavioral habits also tend to be similar among family members, which can reinforce the risk of the disease. Age and hormonal factors. The risk of type 2 diabetes increases with age, especially after age 45. This is because over time, the body becomes less efficient at metabolizing glucose and more resistant to insulin. Hormonal factors such as menopause can also influence making women at this stage most susceptible to the development of the disease. In addition, other factors such as hypertension, high cholesterol and triglyceride levels, polycystic ovary syndrome in women, and a history of gestational diabetes are also important factors to consider. What to do? If you identify some of the symptoms mentioned earlier, it is crucial to seek medical help as soon as possible. An early diagnosis can make a big difference in preventing serious complications associated with type 2 diabetes. Examinations and diagnosis. The most commonly recommended test to diagnose type 2 diabetes is the hemoglobin A1C test. This test measures average blood glucose levels over the past 2 to 3 months, providing a more complete picture of a person's metabolic health. A1C levels of 6.5% or more indicate diabetes. Other examinations include the fasting glucose test and the oral glucose tolerance test. Both evaluate how the body processes glucose at different times, being useful to confirm the diagnosis. Disease control. Type 2 diabetes can be controlled, and in many cases, its complications can be prevented with significant lifestyle changes. The following are some essential actions. Balanced feeding. A balanced diet is a key part of managing type 2 diabetes. Foods rich in fiber such as vegetables, fruits with a low glycemic index, whole grains and legumes help stabilize blood glucose levels. Eating lean proteins such as skinless chicken, fish, and tofu also helps control appetite and balance nutrients. It is essential to avoid refined sugars, such as soft drinks, sweets, and processed carbohydrates, such as white bread and refined pasta, which can trigger spikes in blood glucose. These foods have a high glycemic index and cause rapid fluctuations in sugar levels, which aggravates diabetes. Regular physical exercises. Regular physical activities are recommended to improve insulin sensitivity and aid in weight loss. Aerobic exercise such as walking, swimming, or cycling is highly effective for controlling blood glucose levels. The general recommendation is at least 150 minutes of moderate physical activity per week. In addition, resistance exercises such as weightlifting help to increase muscle mass, which improves the utilization of glucose by cells. Medication. In cases where diet and exercise are not enough to control blood glucose levels, the use of medications may be necessary. There are different classes of oral and injectable medications that help regulate insulin levels or improve the body's response to insulin. One of the most common drugs is metformin, which helps slow down the production of glucose by the liver and improves insulin sensitivity. Other medications such as sulfonylureas and SGLT2 inhibitors may also be prescribed, depending on the individual needs of the patient. Thank you for watching our video. If you are experiencing any of the symptoms of type 2 diabetes mentioned, such as excessive thirst, extreme tiredness, or blurred vision, don't wait. Seek medical attention as soon as possible. Early diagnosis is crucial to avoid serious complications such as heart disease, kidney disease, or even amputations. Taking care of your health is essential, and we're here to provide valuable information that can help you stay in control. See you next time.